Dave, about 6 weeks ago, I took a trip to South Dakota, and I was really amazed at the difference between the way the COVID situation is being handled in St. Louis and the way it's been handled up there. You go into a restaurant up there, the restaurants are packed, people sitting right next to each other.
Wow.
If you walk the streets, go into the shops, there's a lot less mask wearing than there is here. And now we have, of course, one of the greatest COVID spikes in the nation is now in South Dakota.
Yes,
Their
it
infection rate is very high. And now we have a study from the Washington University Business School that attempts to put some business and economic figures on the differences in behavior. Dave, what do you think?
Well, yeah, I mean, because a lot of people seem to think that there's a trade-off between what's good for business and what's good for public health, and this study showed that really there's not in the final analysis, especially when it comes to mask mandates. They looked at places with mask mandates, counties and cities and states with mask mandates and ones without, and they found that consumer spending actually goes up in places where mask wearing is required. Consumers simply feel safer, so they feel more confident going out and spending money in stores and restaurants and the like.
So you wonder, perhaps businesses don't realize this, but you think that once they do realize this, there would be a clamor for mask mandates. We're not hearing that from the business.
No, we haven't. Earlier this year, some business groups issued a statement. They said they want when governors and mayors issue mask mandates, they want them to follow kind of uniform rules, but they never, they've never said, hey, please order masks, please relieve us of the responsibility of policing our customers. I think a business owner feels a little more confident about telling a customer to wear a mask when it's a kind of a regulation issued by the mayor or the governor.
And not only that, but once you mandate masks, I mean, most people are law-abiding people. And if you say you have to wear a mask, even if there's no punishment for not doing it, more people just do it. Another thing that struck me about my trip to South Dakota is all the Trump signs all over the place. Well, Trump country, up and down. And of course, here you probably saw more.
Well, interesting. Yeah, these WashU researchers, they looked at you can get cell phone data that shows kind of how much people are following commuting patterns between home and work, and how much they're following like shopping patterns, traveling from it's the location data from thousands of people's cell phones, anonymous but aggregated, and it tells you kind of where people are more mobile and where they're more following social distancing protocols. And the interesting thing is the best predictor of what how much social distancing is going on in a zip code is whether that locality voted for Trump or for Clinton back in 2016.
So the Hillary people are all standoffish, and the Trump people are all backslapping and touchy-feeling and standing.
And it's a remarkable difference. They looked at all kinds of other variables, including whether there are social distancing rules in place in a given county, and that wasn't even as good a predictor of the amount of social distancing that goes on as the Trump vote. Population density, they controlled for that, and all kinds of other variables.
The interesting thing is that they also related social distancing to infection rates.
Yes.
And they found that if every county social distanced to the lesser extent that the Trump counties did, you'd have like a 1/3 increase in deaths.
83,000 more deaths than we've had to date, which is about a third increase. They did find, if they said it would it would increase consumer spending a bit if we, if we did, less social distancing to that extent, but at a huge cost. I mean, unless the one professor told me, unless you place a very, very small value on human life, it's not a trade-off.
So the restaurants that I saw up in the Black Hills of South Dakota packing people in do better than perhaps, the restaurant down the street here in St. Louis, but more chance of your grandmother dying.
Well, yeah, I mean, maybe in the short run, they could get a little more revenue by doing that, but ultimately, people hear about outbreaks traced to restaurants. I would think they're going to start staying home no matter what the rules are.
It's interesting because economists, being economists, try to put a value on human life.
Yes.
Actually, the government also puts a value on human life. Put a value on human life. And they say that basically this difference would make sense only if you think a human life is worth less than $670,000, which kind of leads us down a very morally tenuous rat hole. Is the 70-year-old's life worth $670,000?
Well, yeah, you could get into all kinds of problematic debates when you start talking about specific dollar figures. But the fact is that in that literature, that's a tiny figure. I mean, if you're talking about how much should we invest in new pharmaceuticals to save a human life or things like that, it's the figures. The typical figures go much higher.
Usually over $1 million.
Yeah, well over several million.
So the bottom line here is that you get a slight increase in business by getting rid of social distancing and a lot more death.
Yeah.
You get a significant increase in business if you tell everybody got
to just ordering mask wearing can boost the economy and make people healthier. It should be a no-brainer. It should be common sense, but and even some conservative states like Utah, I think the governor just ordered a mask rule. But here in Missouri, we do not have a statewide order yet. I would think the business groups should be pushing for it.
I would think so too. So perhaps in the state of Missouri, common sense is in short supply. I don't know.